Hello everyone. Today I'm going to address a specific thing related to ADHD, but it has more to do with the back end of providing the medical care. And this is regarding stimulant prescriptions, or on my end, how much stimulant prescription I can prescribe per prescription at a time. As many of you know already, I spend 20 plus years at Kaiser Permanente, and for my stable long-term patients with ADHD, I routinely prescribe them a 3-month supply of the medicine. So for those patients who are taking the medicine on a daily basis, including weekends, I typically prescribe 90 to 100-day supply because that will cover them for 3 months. And I never had any pushback on that, except during a period of time when there was a national shortage of stimulants. But once we are no longer experiencing the shortage, there's never been any pushback from the pharmacy or coverage from the insurance side to dispense a 90-day supply of the medicine. However, as you know, I switched from Kaiser to Memorial Care in 2024, and almost immediately after I started seeing patients for ADHD, I encountered a lot of rejection for my 90-day supply prescriptions. So most commonly what happens is that I prescribe a 90-day supply. Remember, these are patients who are stable on their treatments and have not had their dosage adjusted for months or even years. So for these patients, it's pretty much a guarantee that they will continue to maintain at the same dosage. So I prescribe a 90-day supply. What happens is that about a month after I see them, I will receive the patient message from the family saying that they ran out of the medicine. And when I look back, I say, wait, but I prescribed you a 90-day supply of the medicine last time I saw you. They say, no, but the pharmacy will only dispense a 30-day supply. And most of the time, I think it's because some insurance pushback at covering a larger prescription. So what happens is I usually have to write a different prescription for another 30-day supply. And that's kind of the ongoing current workflow right now. The patients I will see the patient in every 3 months or so, but every month they have to send me a message so I can refill their prescription. As you may know already, if you're receiving these medicine on a regular basis, these medicine cannot have refills on a prescription. So I can't just write 30-day supply with 2 refills. There can never be any refills on any Schedule 2 medications, and that's a federal law. So once I started encountering this problem, I was curious. I wanted to troubleshoot who is restricting the amount of stimulants that I can prescribe. Because certainly it wasn't me. I know a lot of doctors, they routinely prescribe 30-day, but for me, I know most of my patients who are stable, I prescribe a 90-day supply, and yet almost, I would say 90% of the times, the patient will only end up getting a 30-day supply. So initially I thought maybe it's maybe the DEA, the Drug Enforcement Agency, have changed their policy this year. Maybe because there's a rise in opioid death, and they're cracking down on any restricted prescription medicine that has a potential for addiction. So I actually contacted the DEA directly. I wrote to their public relations department, and surprisingly, a week later, I heard back from them saying that if there's a valid prescription given by a provider who has a current DEA number, active DEA number, and who has legitimate reason and patient-doctor relationship, then the DEA does not impose any restriction on the amount of medicine to be dispensed. So I thought there must have been some pressure from DA to the pharmacy level, but that is simply not the case. There's no federal law that restricts the amount of medicine that can be dispensed, even for Schedule 2 medications. It's a different case for having refills. So no refills, but you can prescribe 90, 100-day supply, no problem. So I thought, well, maybe it's a pharmacy. So when I talked to the pharmacist, they said, well, it's a lot of them are under the impression that there may be a federally mandated restriction on how much medication they can dispense. But if you talk to any experienced pharmacist, this is across the nation, all 50 states, they will say that there's really no state level restriction being posted on the amount of medicine, stimulants that can be dispensed. So then it occurred to me that maybe there's a new shortage of medicine. That's why the pharmacies simply don't have enough medicine to dispense a 30-day or 90-day supply to all the patients. And that's not necessarily the case, because if there's a national shortage, it should affect all patients, but there's about 10% of patients who really never have problem getting their 90-day supply of the prescription. And then occurred to me, maybe it's the insurance company that's placing this restriction. And I see that largely it is the case. And I started to wonder, why would insurance company place a restriction, especially on Schedule 2 medications, because these are medicine that typically we don't have to adjust the dosage very often. It's the same dosage, and we can predictably expect patients needing these medicine on a daily basis for weeks or months or years to come. It could be that because they think in case the dosage needs to be adjusted, or in case the patient loses the medicine, they don't have to end up paying more money for each prescription. Another concern maybe is because with a larger supply, 3-month supply of the prescription, it's easier for patients' family to divert the medicine for maybe illegal use for the black market. That's a thought. I don't know whether that's their thinking. But right now it really appears that it's the insurance company that's placing this restriction on the amount of stimulant that could be dispensed at a time. And of course, this will draw the ire of a lot of patients, because especially we're in the aftermath of the assassination of the United Healthcare CEO, Brian Thompson. And I mean, I'm not sympathizing with the insurance company, but I also understand that they want to reduce costs, but at what cost to the patients and doctors, right? Because it really placed a lot more burden on the patients to make extra trips to the pharmacy to get these medicine that they need on a regular basis. And it does put me in a bind too, because sometimes I feel like I'm caught between the insurance company and the pharmacy. So I have to make a lot of extra phone calls to the pharmacy. But for those pharmacists out there who are watching this video, there shouldn't be any legal restriction on the amount of stimulants that can be prescribed at a time. So if you're unsure, you can consult the supervisor or other fellow pharmacists. And at this time, the conclusion is that the insurance company is really putting the control over these substances, and I'm hoping that there could be some reform so that we can place the interest of the patients and the convenience of the patients before small cost reduction. Potentially there is not necessarily a loophole, but of the patients that I found, they're able to get a 3-month supply. Many of them go through a mail order pharmacy. So if you can advise the patients to find a mail order pharmacy that's covered by their insurance, a lot of times they will dispense a 90-day supply without any issue. Okay, I think that will conclude our discussion today. If you have any questions, let me know. If you come up with any topics that you want me to discuss, send me a message and I'll be glad to make a video just for you. Take care. Bye bye.